Heat stroke in dogs is a medical emergency, and the first signs can look deceptively ordinary. If your dog is panting harder than expected, drooling heavily, or becoming weak in warm weather, stop the activity and start cooling them immediately. Minutes can matter. Normal panting should begin to settle with rest, shade, and cooling. Heat stroke panting doesn't. It keeps going and may be joined by changes in saliva, gums, the stomach, balance, or awareness. In this video, you'll learn why a dog's cooling system can fail, the 7 warning signs, where heat stroke catches owners off guard, what to do immediately, and which cooling mistakes to avoid. Welcome to Instin Paws, where we separate dog facts from dog myths. Dogs don't cool themselves the way people do. They have sweat glands in their paw pads, but panting does most of the work. Moisture evaporates from the tongue and upper airway, carrying heat away. In high heat, the air they breathe is already hot. In high humidity, evaporation slows because the air already holds more moisture. Put the two together, and panting can become much less effective even while it still looks like ordinary panting from the outside. Normal panting after exercise should ease with rest, shade, and water. Overheating may look like panting that is heavier than the activity would explain and slower to settle. As heat stress worsens, panting may become relentless and be joined by drooling, weakness, or other warning signs. You cannot reliably label precise stages at home, and there is no clean line between them. What matters is recognizing that your dog is moving in the wrong direction and acting early. Heat stroke can build quickly, and the timeline depends on more than air temperature. Humidity, exercise intensity, shade, and airflow all matter. So do breed, age, body weight, and existing medical conditions. A hard game of fetch in still, humid heat is very different from a slow walk in shade. 2 dogs in the same place may also tolerate the conditions differently. Watch your individual dog's signs, not the thermometer alone. Heat stroke does not only happen in parked cars or during obvious heat waves. It can develop on ordinary walks, during running or fetch, in poorly ventilated rooms under grooming dryers, on hot patios or decks, at the beach, on exposed hikes, inside travel crates, or at crowded outdoor events with limited shade and water. These settings can look routine, which is exactly why owners can be caught off guard. Let's start with a sign most owners see first and dismiss first. A dog who's a little warm pants with the mouth partly open, glancing around, swallowing now and then. That's ordinary, and it usually settles within a few minutes of rest. Heat stroke panting looks different. The mouth goes fully open. The tongue extends further than you're used to seeing. Your dog seems unable to catch a full breath, even sitting still in the shade with water in front of them. This sign becomes more concerning the longer it continues without easing, especially paired with restlessness. Move your dog into a cooler area immediately. If the panting does not begin to ease promptly, or if drooling, weakness, vomiting, or abnormal behavior appears, start cooling and contact a veterinarian. If the panting doesn't ease, check the tongue itself. As the body works harder to cool down, blood rushes toward it, and the tongue can look wider or more swollen than normal, sometimes developing a rounded, heart-shaped tip, and it may hang further to one side. On its own, this doesn't confirm heat stroke. Plenty of healthy dogs just have a naturally broad tongue. It becomes more concerning alongside panting that won't settle, or when the shape changes noticeably over the course of an afternoon rather than staying the same. When a widened tongue shows up alongside relentless panting, it's a sign your dog's cooling system is working overtime, and it's time to pay closer attention to what comes next. Sign 3 shows up around the mouth. A hot dog naturally produces more saliva, since evaporating it is part of how the body sheds heat. You'll see it collecting around the mouth and chin, sometimes soaking into the fur on the chest. A little extra drool isn't unusual on a warm day. What matters more is the texture. If that saliva turns thick, sticky, or stringy, it's often a sign dehydration is setting in, and paired with panting that hasn't let up, the situation is moving in the wrong direction, not stabilizing. This is more concerning if your dog also seems reluctant to drink, or drinks and still isn't producing normal saliva. From the mouth, sign 4 moves to the gums. As dehydration progresses, gums that were moist can turn dry or tacky to the touch, and color tends to shift too, often toward bright red or brick red, as blood vessels widen to dump more heat. Later on, gums can change again and look pale or otherwise abnormal. This is more concerning alongside the drooling changes we just covered, since both point to the same underlying dehydration. Don't get stuck trying to identify the exact shade. Gum color is hard to judge precisely, even for experienced owners. If something about the gums looks off, treat that as reason enough to act. Sign 5 moves past the mouth and into the stomach. Once a dog's body is overheating, the digestive system is one of the first places to show strain. Vomiting or diarrhea, during or shortly after heat exposure, is a real warning sign on its own. The body is already struggling to keep up, not just uncomfortable. This becomes more concerning alongside the weakness or gum changes already covered, since it suggests multiple systems are under strain at once. Blood in the vomit or stool is a more serious escalation and needs urgent attention. Sign 6 shows up in how your dog moves rather than how they look. Watch for repeated lying down, trouble getting back up, staggering, or a general weakness that wasn't there an hour ago. Any one of these can mean the body is starting to lose the fight against the heat. This is especially concerning if your dog keeps lying down even after you've moved them somewhere cooler, rather than perking back up with rest. A full collapse is the clearest signal of all. This is no longer a situation you wait out at home, hoping it passes. The 7th and final sign is also the most serious: confusion, seizures, or loss of consciousness. This can look like disorientation, a slower or absent response to your voice, twitching in the limbs, or your dog seeming mentally somewhere else entirely, even while looking right at you. It's especially alarming when it follows the signs already discussed, since it usually means earlier warnings were missed or heat exposure continued too long. These are not early or mild symptoms. They're critical emergency signs, the point where the body's systems are being overwhelmed. If you see any of these, you are well past the window for waiting and watching. Some dogs have less margin for error in the heat. Flat-faced breeds such as bulldogs, pugs, and boxers may cool less efficiently through panting. Senior dogs, puppies, overweight dogs, thick-coated dogs, and dogs with heart or breathing conditions can also be more vulnerable. Limited access to water, shade, or rest increases risk for any dog. These are higher-risk groups, not the only dogs that can develop heatstroke. So if you notice any combination of these signs, here's exactly what to do in order. First, stop all activity right away. No finishing the walk, no last few minutes of play. Second, move your dog safely into shade, air conditioning, or any cooler space you can reach. Support them if they're unsteady rather than letting them stagger on their own. Third, begin cooling with cool or lukewarm water over the body, focusing on the belly, armpits, and groin, where blood vessels sit close to the skin and cooling has the most effect. Fourth, add airflow with a fan or the air conditioning if you have it. Moving air across wet fur speeds up cooling, the same evaporation principle behind panting itself. Fifth, if your dog is conscious and able to drink on their own, offer small amounts of water, but don't force it into their mouth. Sixth, call an emergency veterinarian immediately, even while you're already cooling your dog down. Do both at once, on the phone while your hands are still wet. And seventh, if you need to transport your dog, continue cooling during transport with cool water and strong airflow from the air conditioning. Avoid wrapping your dog in towels because they can trap heat. One more thing worth repeating: don't wait for your dog to look fully recovered before getting professional care. Looking better on the outside doesn't mean the danger has passed on the inside. When you call or arrive, give the veterinary team the details that matter most: how long your dog was exposed to heat, what activity they were doing, which signs you saw, whether they collapsed or vomited, and what cooling you have already started. Mention medications or existing conditions, and if you are already traveling, give an estimated arrival time so the clinic can prepare. Just as important as what to do is what to avoid, because some instincts here actually backfire. Don't use an ice bath. Extreme cold restricts blood vessels right when the body needs them wide open to move heat out, which can slow cooling rather than speed it up. Don't wrap your dog in a soaked towel and leave it there. A wet towel traps heat against the skin instead of releasing it, working against you within minutes. If you're cooling with a hose, check the water temperature first, since hose water sitting in the sun can come out surprisingly hot. Don't force large amounts of water into your dog's mouth. Beyond the risk of choking, it doesn't speed up cooling. Never leave a dog in a parked vehicle, even briefly. A car heats up far faster than most owners expect, even with a window cracked. And above all, don't delay emergency veterinary care while you try to manage this at home alone. Cooling buys time. It isn't a substitute for treatment. A simple summer plan can prevent many heat emergencies. Check both temperature and humidity before heading out. Walk earlier or later when conditions are cooler, plan for shade and water, carry water on longer outings, and shorten activity on hot or humid days even if your dog still wants to continue. Check hot pavement before walking, supervise higher-risk dogs closely, and never rely on a cracked window to make a parked car safe. Heat stroke rarely starts with one dramatic symptom. It often builds from panting that no longer settles into drooling, gum changes, stomach symptoms, weakness, or altered awareness. The earlier you interrupt that progression, the better. You do not need to remember every detail from this video. Remember this: if the panting will not settle, do not wait to see what comes next. Start cooling and call your veterinarian. And if your dog pants heavily even when the weather is not especially hot, watch, why is your dog panting so much? Normal versus serious causes, next. Until next time, stay curious, and keep listening to what your dog is trying to tell you.